Okay, hi everybody. I think we're going to get started with the afternoon session. Sure, yeah. If you have friends that wanted to come in for the session, if you want to let them know, we're going to get started so we can kind of stay on time this afternoon. I'll give you a little overview. So I'm going to talk a little bit about resiliency as an overview on the topic and kind of qualities that individuals that are resilient have and how we can build those skills. And then it'll be followed up by a fabulous speaker who I probably am embarrassing, but it's going to do a nice interactive session. I think she's very special, and I'm personally looking forward to hearing Desiree come up after me. And then finally, we'll kind of wrap up our afternoon session with the RAINS initiative and talking about patient engagement, which again, I think is going to be an extremely important topic. And we've just had a nice lunchtime conversation engaging families and patients, which is very invigorating. Okay, so I'm going to talk about resiliency. And when we were putting together the program, we certainly got feedback from prior years that we need more adult topics. And then there's other years where we focus on the adult topics, and then we get feedback that we'd like more pediatric topics. So, and then certainly we're not just talking about NF1 at this conference. We have various disease groups that are here. And I really started to try to think about what covers all of this? What is not so specific to children or adults or a specific disease or a specific challenge? And resiliency came to mind, and how we can build that and really keep moving forward despite our challenges or despite our difficulties, whatever those are. So I hope that you find this to be a good topic to cover the bases, and then certainly Desiree will be telling her story and how she's overcome many challenges in her life and how she moves forward. So I wanted to start by telling a little bit of a story of someone I know. So this is Tess, and Tess is my research assistant at Children's. And Tess started working with me this past year, and she was in fact a patient at Children's National. And I said, I really want to tell a little bit of a story because it's boring to talk about definitions of things, and I want to be able to have a story people can link what I'm talking to. So she said, well, I'll tell you my story. You can read it to them for me. So I'm going to start, just bear with me. I want to read what she wrote about her experience and what she's overcome. So she said, I found out that I would have to have my third open heart surgery the winter before my sophomore year in college. My cardiologist told me that I would most likely have to take the spring semester off because it would be too difficult to have open heart surgery and recover while keeping up with my schoolwork. I was devastated. I was looking forward to my classes, seeing my friends, and starting my position on my sorority's executive council that I had been elected to into the semester before. More importantly, I didn't want to have to graduate a semester late. Luckily, I was able to plan my surgery in mid-March, a week before spring break. This allowed me to balance some of the time I had to take off with the holiday, so I only had to take 2 full weeks off of school. When I returned to school, I attended all of the classes I could when I was physically able. While walking the 15 minutes to class was easy before the surgery, it took me over twice as long to walk to class after surgery, and I was extremely fatigued by the time I got to class. I struggled to remain focused in class during the first few weeks back. It took all of my energy to get myself out of bed, get dressed, and actually get myself to class. By the time I got there, I was exhausted and in pain. Luckily, my professors were very understanding, and they were accommodating when I would arrive to class late, be distracted during class, or if I could not even make it to class. I kept in constant contact with my professors to ensure I was keeping up with all the material that was being taught, and had to spend much of my free time trying to keep up with the pace. Through my dedication to my classes and never giving up, I achieved straight A's in all of my courses by the end of the semester. Shortly after returning to school, I received an email that the Psychology Honors Program was accepting applications for second semester sophomores. I read that only 5 to 10 students were accepted. It included taking graduate-style seminars and conducting a thesis. It sounded amazing, but at the moment, I couldn't even imagine how I could possibly bring myself to take on more work when I could barely do daily activities, without getting extremely fatigued. I was feeling down and unmotivated. It seemed pointless to apply for something so competitive when breathing was even a difficult task at the moment. But then it dawned on me that these emotions and pain were only temporary. I would regain my strength, mentally and physically, and go back to my normal activities within a few months. I knew I couldn't allow my current situation to affect something that could have such a great impact on my future. I applied that night and was accepted into the program a month later. Although having open heart surgery was a miserable and exhausting experience, I can now say that I would not have changed a single aspect about it. I know what I'm capable of mentally and physically. I have the strength, motivation, and confidence to surpass any obstacle that is placed in front of me. Because of my surgery, I am more in tune with my body and my mind. I am more comfortable with myself now than ever. I know who I am and what I want out of life. One of the most valuable things I have learned is that bad things may happen to good people, but finding the courage to be grateful for what you have and the ability to understand that it is not the adversity itself, but how you handle the adversity that sets you apart. So I know that's a little bit of a long story, but I thought Tess really did a beautiful job of talking about adversity, that adversities do happen, that it's not easy to pick yourself up when you feel unmotivated or down about the situation, but that you have a choice, and you can choose to take ownership of your life and where it heads. And as I walk through resiliency from a little bit more of a scientific standpoint, I want you to remember different aspects of her story that really highlight both the external factors involved in resiliency and the internal kind of personal factors that are involved. So resilience, from a scientific definition standpoint, the American Psychological Association says it's the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, which may include family and relationship problems or serious health problems. So you can see our little green thing kind of growing out of the dirt, and that's the idea, is that even again, with no resources and nourishment, you're resilient, you're able to kind of come up out of that. So again, what I was saying is this is not disease or experience specific, which is what I love about resiliency, because any of us can apply these concepts and these approaches to any of the challenges in our life. And they can be learned. So some people feel like they're not resilient, but there are things that we can learn in terms of how to view life, how to approach life, that can make us more resilient. So what's nice is about 20 years ago, we spent a lot of the years of psychology focusing on what was wrong with people, right? We talked about a lot of diseases and disorders and problems that people had. And finally, there was a bit of a shift where we realized there are a lot of people in the world that do well, in spite of sometimes very horrific stories. You can hear about young children who have not had the best upbringing really thriving, and you sort of feel like, how does that happen? How can somebody go through something so significant and come out the other side as such an amazing human being? And so I think psychology finally got the picture and thought, we need to study those people and figure out what qualities do they have, what makes them rise above the challenges or the experiences and succeed in life and have a good quality of life. We also know that resiliency affects health, right? Physical and mental health. So when we're able to approach life in a resilient way, there's more positive outcomes, regardless, again, of what our challenges are. So stress obviously is bad for us to some extent, although certainly a little bit of stress is good, right? Because it's motivating. So when we have a little bit of stress, we certainly know that we kind of want a little bit of that in our life, but we don't want so much stress that it really limits us in terms of moving forward. The negative consequences of extreme stress are not inevitable, and resiliency can really have a very positive influence on the progression of illness. So we know that, again, when we have higher levels of resiliency, which we'll get into more factors of, is associated with greater quality of life and lower distress. And we did a project within our NF camps one year, and the social worker collected information on resiliency, quality of life, the presence of different learning or cognitive disabilities, and we looked at those things together, and what it showed was certainly that when children had more disabilities, they had lower quality of life, but those children that had a higher level of resiliency and factors involved with resiliency, their quality of life was better despite having disabilities. So again, it kind of shows you that moderating relationship of these resilient factors and how they can improve life regardless of challenges. So I thought to myself, I don't think everybody in this room would believe me if I told you that you're probably more resilient than most people in your life. But it is actually true, and the research also has shown that people that are faced with adversity actually adapt to and adjust to their adversity in ways that people who may not experience adversity will not. So just the experience of having an adversity in your life actually makes you stronger. And again, that doesn't mean it feels that way all the time, and it doesn't mean that this is simple or, you know, it's not challenging or difficult. It just means that you actually probably have much more in the way of resources psychologically than you realize. And that we really, you know, the research talked about this exposure to stress also can be followed by an increased resistance to later stress. So again, it's just that building. Now I think you think about, you want to build a bit of a protective shell, but certainly not a wall, right, where you're then closed in or shut down. So it's all a little bit about balance, just like we talked about stress and the level of stress. So some factors in resilience. It's an active process, right? It's not just something you decide to do, you get your resilience and you're done. It's always an active process because there's different things going on at different times in our lives. And we were just sitting at lunch and talking about what's driving us today. Well, today it's the tumor, tomorrow it's the ADHD. You know, it all depends what you're faced with on a daily basis. It's not going to be one simple source of stress or one single trauma. It's day to day, sometimes you're dealing with something very different, or it may be pain one day. So it's an active process, and we make decisions as we go. There are internal or individual factors involved in resilience, as well as external or more environmental factors. They're all important. Two keys, though, I think that when they study people that are resilient, what they find is that those people are very aware that they're responsible for their own well-being. So they take ownership of that. It's not externalized. And in psychology, we talk about locus of control, and that means, you know, where do you think the control lies? Is it external, where you're making statements like, you know, if I just don't have pain tomorrow, everything will be better, or if I can focus better, or my child can do okay in school, we're going to be much better off, I'd be happy then. That's more externally based. And that's problematic because we can't control a lot of our external world in that direct way. But we can very much control and have an effect on our internal world. So when you feel like, I actually can exert something onto this situation, I can change the dynamic, that's very powerful. And again, keeping with the theme of this conference, this is an extremely empowering and powerful concept, is to say, I'm responsible for this, what am I going to do about that? The other characteristic that is commonly seen in individuals that are more resilient is that they view difficult situations or experiences as a platform for personal growth. So my experience is not one I would choose, but I see it as a way to help others, or to better myself, or to reach a new level, or challenge myself. So I liked this graphic because it's sort of, you know, we have our different factors in the middle that go into being resilient, or what this suggests is being more vulnerable. And I like that vulnerability kind of side of this equation, just in terms of showing the balance there. And then it shows, you know, more health to more disease or disability status. And all these factors are in play. So those individual characteristics, as well as, you know, our environment and what we have around us to support resilience. So this is certainly not all of the individual characteristics that go into resilience, but I picked some of the top, and then I'll go into each of them a little bit further. Certainly optimism, and we'll talk about realistic optimism, is a key factor. Being flexible and having good problem-solving skills, so not getting stuck in one approach. Being courageous or brave. I think being resilient takes a lot of bravery. Conscientious, or kind of stick-with-itness. Sense of meaning or purpose in your life, and for many people, spirituality or religion has a lot to do with resiliency. So when we're talking about optimism, we're not talking about optimism that's not realistic, where we just say, oh, everything's great, you know, when it's not, or this is easy to deal with, it's no problem, I'm fine. That's not the optimism we're talking about. We're talking about realistic, where we acknowledge the challenges, we acknowledge that it might be an experience that's not one we would choose, but we feel hope about the future, about what can be, about how we can handle it, or where we can go from here. So it's very future-oriented in our attitudes. It's not getting so much stuck in the past. I know when I work with parents, a lot will question, did I do this too late? Did I make this decision, you know, well beyond when I should have? And I don't really let them do that in my office, because there's no room for that. That's past-oriented. We're talking about moving forward. You do the best you can in the moments that you're in, and then you move forward. We're humans, you know. That internal locus of control, as I mentioned at the beginning, is also important and associated with optimism, the hope, as I said. And then being able to step back and look at the big picture. That's something that's not always easy. And again, when I'm in the office with families, I really make a point to do this with them, because when you're in my office, you have a problem, right? You're seeing me because something's not going okay. You're very concerned about something, so we get tunnel vision. And often you're missing the fact that you've done an amazing job, whether it's you personally and you're struggling with NF or various things, or you're the parent of somebody who's struggling. And so I really like to take that step back and look at big picture, because it's extremely important, and it's a reframe and it's a reset often for families as they're trying to move forward and build a resilient kind of approach. And then optimism is sort of the fuel, it's the gas that ignites resiliency. So this is a key factor. Now, some people may say, well, I'm described as a pessimist. Well, we can help with that. If you hang around me long enough, you'll be fine. So flexibility and problem solving is another aspect of resiliency, and individuals that are resilient that they show. Flexibility is important, right? Because the world we don't really operate in black and white. So the world it's the gray areas that we're living in every day. That's where we need to operate. So when you tend to be someone who sees things as, one way or another in very black and white terms, it causes difficulties, and it makes it difficult to move through the challenges, because it's an either or. And that doesn't usually work out, because it's like the child who's maybe more anxious and sees that they've either gotten 100% on a test or they failed, because that's the other option for them. That's not reality, and it's not helpful, because it really gets you stuck in the pass or fail. I'm perfect or I'm a failure. So when you are a less flexible thinker, it makes it difficult to be resilient and to move through. I think having gratitude and humor, I don't know that it really fits into this slide perfectly, but those are important in terms of flexibility as well. I think we've had some nice humor with my British co-chairs in this session, and I really appreciate it, and we can always use a laugh. But also being grateful for things. I think, again, that reframe and that big picture, when you're in a moment that's difficult, it's hard to sometimes feel grateful for other aspects of your life or certain things. So it's that step back can be helpful in building gratitude and having a little bit of a laugh at things. So I love this picture. It totally cannot be real, but I'm sure you've seen it on the internet, and it gives me anxiety to look at it, but I thought it fit with bravery and courage very well. So being brave, that's important. You have to take a risk, like this little guy. It's not easy to do that. That's probably one of the hardest things to do, is take that leap. Remember Indiana Jones when there was no bridge, and he basically has to jump and then the bridge appears? That's sort of our lives. You're always having to step off the curb and just take the chance, or try to get yourself to take that step. And many wonderful things happen when you do that, and I think when Desiree shares her story, I think you're going to hear a lot about bravery and taking that leap of faith, and what gift she's gotten from that in her life. Fear can be an opportunity. And again, this takes work. This is not, I think most of us don't think this way. When we're worried about something, we're afraid of something happening, we don't necessarily see it automatically as an opportunity. But I think believing that you can, bless you, believing that you can move forward despite the challenges and roadblocks and fear is certainly a key. They talked about sort of having a moral compass, and I thought this was an interesting bit of the research that's out there. But, everybody has different core values. So some of it's about identifying what yours are and kind of assessing, where am I with that, and then using that as a challenge to strive to be better or adopt a higher standard for yourself. And this isn't in the context of what other people think about you, or it's for your own compass and your own kind of what's important to you in your life and your family's life. And then I think that never give up attitude. Again, it doesn't always feel like this. There's certainly moments you're not going to want to try at all, and everybody's probably been there in this room for various reasons, and sometimes you can't do this on your own, and that's why when we talk about the external factors in resilience, that's where that comes in a lot. It's groups like this, where I think every one of us that comes to the forum every year, it's more than amazing, because one of the things Desiree and I were talking about, I said, this room is safe. I feel like the speakers feel safe in here, people in the room feel safe with each other, and not everybody knows each other, but it feels like a place where you can take your risks and you can keep moving forward. And the external groups like that have a lot to do with when you're not feeling that get up and go and that I won't give up. Sometimes you you need the other people in your life to say, come on, I'll help you along, because I was there too. And then finding meaning and purpose and challenges in life, I think this is sort of a higher level of resilience in my mind where, again, you kind of accept that you're responsible for how your life is going to go. But also that many people that are resilient find that their challenges led them to either helping others or finding something, achieving something new in their life, and that it had some meaning in their life to bettering themselves, and they use that as motivation to push forward in various ways. So in terms of those more environmental and external, I won't spend a lot of time, I kind of really touched on this, but social support, and that might be in your own neighborhood, your friends, your family, anybody that's sort of in your social network. And then I think role models and mentors, those are important people in our lives as well. And then you may find that religion or other kind of support and organized groups are an important part of your life in terms of giving you that external support and moving through. So I think the important part of social support is that it's an interdependence with others, but not a dependence on others. So again, when we're talking about that internal locus of control, that internal sense of I can affect a change, it wasn't based on what somebody else might do for you. But it is the social support of the other people in your life. And then, role models and mentors, that might be a family member, might be somebody here in this group that's really kind of helped you through. Professionals can be role models or mentors, and I think our kids are certainly mentors and role models for us. And again, I keep bringing Desiree up, but we were just talking about this, that they really kind of recenter us at times when we're off the rails a little bit, and they keep it pretty simple, and I think it's very helpful, and they give us some sense of, move forward. This isn't the end of the world, let's keep going. They're often quite resilient. Again, I think specific groups like the Forum, we have the NF camps where the kids go and they become counselors. All these types of things are places we can get external support if we're not particularly optimistic, or we're, these qualities that we talked about that relate to resilience, if those aren't in our nature, we can get those by connecting with other people that do have those strengths. So this is my final slide, and I think is a good lead into our next speaker, but everybody has some ability to be resilient, and most people actually are resilient, and probably more so than they know. And certainly if you feel like you can be more resilient, we can certainly learn to build and strengthen resilience, and then the impact of that is an improvement in quality of life. So that's my talk, and I thank you.